All right, Mod 2 exam review. Should be chapters 9 and 10 in your book. This is only a 35 question test. Some people think that's a good thing, some people think it's a bad thing. Problem with 35 questions is you miss just a few and you start to go down on the percentage pretty quick. Things you need to know for this exam. You need to know what the different sounds, airway sounds are, how they're described, what each one of them are. So you need to know things like gurgling, rhonchi, rales, stridor, wheezes, where they happen at. So wheezes are lower airway obstructions. Stridor is a high airway obstruction, a high-pitched noise. You need to know those things. You need to know the anatomy of the airway. So the carina and the bronchioles and the trachea and all of that, you need to know where those things are. You need to know what happens when somebody becomes unconscious. What are the concerns there? How can that affect their breathing and their airway control? You need to know what signs of an inadequate airway are. What things are a good sign that something bad is happening to the patient. You need to know what to do if a patient vomits and you need to keep his airway clear. And that's one of those things you got to do really, really quickly. So if you don't have suction right there, what do you do? You need to know when to use an OPA and when to use an NPA. What's the benefit of your NPAs? What's the benefit of your OPAs? You should know how long to suction. We talked about that quite a bit in the test. Whether to suction on the way in or whether to suction on the way out. Should always be on the way out. You should know when to use a hard catheter suction versus soft catheter suction. We kind of talked about that a little bit. You need to know the difference between hypoxia, hypercarbia, all that good stuff. Remember, you're doing ABCs, airways always first, and you need to stop and fix the airway if there's a problem. So if you get to, in your assessment, if you get to airway and there's an issue, you need to fix airway before you move on to breathing or circulation, right? You need to know the terms of ventilation and respiration and what's different about those and how those work. You need to know what causes the human body to breathe. What receptors tells the brain, hey, take a breath, dummy. You need to know that. You know what the term minute volume means and how to calculate it? I'm not going to make you do calculations, but you need to know what it means and how to calculate it. There's some simulation questions on here. You should hopefully know what to do based on your lectures. You need to know how to deliver high concentration oxygen. So remember, we have a skill station about this. When to use a nasal cannula, small baby oxygen. When to use a non-rebreather. Okay. You should theoretically know the percentages of oxygen with each type of mask. So nasal cannula, what percentage of oxygen is the patient receiving? Not what do you set the bottle at, what are they receiving? There's a graph in your book on that. So what are they receiving with the nasal cannula? What are they receiving with a simple face mask? What are they receiving with a non-rebreather? Kind of hard to remember those, so maybe you should focus on that a little bit. Remember, in EMT class, we put on non-rebreathers on 90% of our patients. So if they're having problems, shortness of breath, we're going to throw a non-rebreather on them every time. I think we did this in our skill station, but with non-rebreathers, how do you get them to work? What do you need to do to make them work? What should you do before you just slap somebody on them? Like, you know, they don't let you rebreathe, so maybe turn on the oxygen. Make sure there's oxygen in there for them to take. All that's pretty important. You need to know the different portions of the oxygen tank, what they do. You need to know what colors an oxygen tank is. Lots of oxygen tank questions on here. So, make sure you know your lung sounds. Make sure you know your oxygen tank parts and what they do. Make sure you know what a regulator is, what safe operating pressures on an oxygen tank are, those kind of things. 35 questions. I would definitely review your book. I would definitely review your terms and make sure you understand what's going on. Not a huge test, a lot of material. We had several hundred slides, so I will send out some terminology, I think, tomorrow via email for you to review. I'll get this posted. If you have questions, email me, call me. We'll get them answered. Any questions? All right.